So hello everyone, welcome to this super exciting episode of knowing all about Plab as well as our new courses that we have just launched for Plab. Hello Dr. Shubhank, we have with us Dr. Shubhank Singh all the way from UK. Shubhank is working there as a doctor in the NHS system, and today we are going to be discussing all about Plab, UK and so many opportunities that you can have for all the international doctors who want to go and work in the UK. So why did we do this? I'll just give you a small brief up of exactly why this happened. You know that we've been doing USMLE for the last almost 10 years here in DAMS, and when I saw the difference, we have about 10 to 12,000 students who give the USMLE every year. And we have over 15,000 students who give Plab every year. And Dr. Shubhank just gave me the figures that 15,000 gave it last year in 2022, and about 10,000 students cleared Plab Part 1, and about 13,000 gave it in for Plab Part 2, and only 8,700 could clear. So what we got out of this is that we also read many articles stating that over 10,000 registrations from international students were there in the GMC last year, and that is a very big number. Even the UK and the EEA students put together, the international students weighed heavier. So this gave us an idea that good number of students want to go to the UK, obviously for better reasons. Dr. Shubhank is going to elaborate on those reasons and tell you why UK is somehow very much lucrative for students from India, and what are the advantages of going there, and exactly what is the pathway to go there. So welcome Dr. Shubhank to India, and welcome back to India, I should say. And could you just tell us a little bit about yourself and why do you think Plab is the need of the hour today?
Hello everyone, thank you Dr. Mala for the nice introduction. So I am basically an Indian doctor, international medical graduate, and I started my work in the UK, and this journey is amazing because you're exposed to something new, something innovative, a new type of system. And if you have gone through these exams, these Plab exams, I would say your journey becomes easier because they train you during this Plab preparation, Plab-1 and 2, what could be the common clinical scenarios which you will encounter as a junior doctor whenever you start your job in the UK. So I would say these exams are really very important in terms of training you as a junior doctor so that you feel confident when you start your work.
Okay, so I think what we need to do is we will rephrase the question again. Apparently the mic was not in place. So let us just restart the last part that you said again about why Plab is the need of the hour today.
Right. So there are different ways where you can work as a doctor in the UK. Definitely you need registration from General Medical Council, that is known as GMC UK. Most of the students try through the Plab route, that is Plab-1 and Plab-2, which you can start after giving your English exam and in your particular score in that. Some students even go by the membership exams of the Royal Colleges, MRCP, MRCOG, etc. So sometimes they feel difficult, to adjust in the system because, when you start there as a clinical fellow or a senior clinical fellow, so you may find some sort of difficulty in terms of I would say adjusting with this environment in the NHS, how to put orders and stuff, and you get more confidence when you go through the Plab route. So it becomes very easy for international medical graduates to be part of the system, especially when you are joining training jobs as a SHO, FI2 doctor or clinical fellow.
Okay, so that's very good. Do let us know in case the voice is still not clear. Apparently there is some disturbance in Dr. Shubhank's voice. So what we are going to do now is, since we have a lot of you students who are interested in the journey to UK and they are asking your own questions regarding your own personal journey, before that I thought let me ask him a few questions on my end which will give us a complete idea as to what are the different aspects of Plab and the UK journey. And once we have the answers from Dr. Shubhank for the regular frequently asked questions, after that you can, all of you, please send your questions on the app so that we can ask those questions to Dr. Shubhank and get all our doubts cleared. Okay, so basically Dr. Shubhank, that is the most common question everybody asks: what is Plab? And can you just elaborate about Plab as well as the licensing exam?
So PLAB, the full form is Professional Linguistic and Assessment Board. So this is an exam conducted by the professional body General Medical Council, which gives you a license. So doctors, when you start your practice here in India or any Asian country, you always take a license to practice as a registered doctor. In the same way, in United Kingdom, you need a license from General Medical Council, which is known as DMC license, and this is given when you pass PLAB exam or membership exams. So here we are talking about PLAB exams, which has two parts, Plab-1 and Plab-2.
Okay, so you are saying that unless you have a GMC registration from any part of the world, if you are an MD or an MBBS, you are not eligible to work in the UK as a doctor?
Right.
Okay.
Or any medical job in the UK, you have to have a license from the GMC.
Okay.
You should be there in the GMC register. There are different pathways. For example, some doctors join just after MBBS. Okay, you can join. Some doctors join after their PGs in India, postgraduate degrees like MDMS. Then also you can join, some doctors join after Royal College exam, that is membership exams like MRCP.
Okay.
Some doctors go via MTI route, Medical Training Initiative, which is a route for 2 years. You go there, work there, and then you come back.
Okay.
But in every scenario, you need General Medical Council's license.
All right. And the licensing could be any exam. PLAB is just one of them, but there could be other routes as well.
Yes. So
right.
You can obtain your license through membership exams also, like MRCP, MRCOG, MRC, in psychiatry, in different MRChem in emergency medicine. But the most preferred route, easiest route,
is the PLAB,
which really helps you in your further training, is PLAB. So far.
Yes.
You can see the number of students giving Plab-1 and Plab-2 exam, and the number is increasing every year.
Yes.
And even the passing percentage is also increasing.
Absolutely, absolutely. And that is why we really felt the need to have PLAB courses here to help the students. Now, do you need any experience to be eligible for the PLAB examination?
Yeah, very good question. I would say, because many students who are presently studying in their MBBS final prof or doing internship, they are very keen, like in the USMLE, they start their journey very early. However, in the PLAB, you should have your final degree with you.
Right.
It means like after passing your final prof, when they give you a provisional certificate, on the basis of that also you can, start at least preparing for English exams, because you can only book your Plab-1 exam once you pass your English exam.
Which is IELTS? Okay.
You can give IELTS IELTS exam.
Okay.
Or there is another way now, which is OET, Occupational English Test. Because it has been seen that IELTS is a very general English exam, where you are asked to write essay on, museum, fashion technology, sports. And when you are a doctor for like 5-6 years in medical school, you find it very difficult and challenging.
True.
I find it very difficult.
Yeah.
But then when this OET was introduced, the content is in English.
Right.
So you are writing a letter, a referral letter to a consultant rheumatologist.
Yes, yes.
Or you are listening to a conversation between a medical student and professor.
Right.
So that way the content is medical.
Right.
So it becomes very easy for healthcare professionals to give OET exam.
Yes.
However, I'm not saying like which exam is better. It really depends on you.
On you, yes, yes.
But you have an option.
You have an option, which is very good, because as Dr. Shubhank rightly said, I know a lot of students who came into USMLE because they weren't able to clear the IELTS in the first place, and one of the students, a bright, brilliant girl who had not been able to clear IELTS for 2 attempts, and then she said, okay, just check it, let me just go ahead and go for USMLE, because they didn't, we have only the USMLE licensing exams for passing the USMLE. So you're right, if you have an option of OET, which seems to be an easier exam for medical professionals to take. All right. So how is the structure of the PLAB examination? Can you just give us a little idea of that?
Right. So as I told you, you start your journey as, clearing your English exam, where if you are giving OET, Occupational English Test, you have to secure B grade. They grade you like ABC. So you secure B grade, which is like the passing minimum, equivalent to 7 score in IELTS. So if you receive B grade in all the 4 parameters, listening, reading, speaking and writing, then you can book your Plab-1 exam.
Right.
In the same way, if you give IELTS and you secure 7 in each of these listening, reading, speaking, writing parameter and overall 7.5, then you can write your book, you can book your Plab-1 exam. Plab-1 is a 3-hour exam. So in 3 hours you have 180 questions. So 1 minute, 1 question. And I just want to give you this confidence that this exam is all about mindset. They are checking your knowledge, but they are also checking your common sense, because you'll find a lot of questions where they are asking you next appropriate step, the best treatment modality, and they are checking your knowledge as a junior doctor, as a intern who is starting career in the NHS. So they are not asking you, to be honest, anything rarest of rare or any difficult question. If you see the content of Plab question, the questionnaire Q bank available, you will find most of the questions are very basic questions which any MBBS doctor can answer that.
Okay, so this is another thing very interesting you have mentioned, Dr. Shubhang, because I think too much knowledge here is dangerous. If you are well prepared, and if you are, as a junior doctor, you're planning to go for Plab, you probably will have a better concept and idea of the exam, right?
So now, as you said, like Plab-2 exam, we have seen many specialists not passing that particular station. For example, if you are a specialist gynecologist, you may struggle, because right now they are checking your knowledge as a junior doctor, not as a specialist doctor. And in the UK, they are very particular that you have to be a very safe doctor.
Right.
So you have to take, before discharge, speaking to your registrar or the consultant is very important. So that whole, the atmosphere in the NHS, all those protocols, nice guidelines, you should know. So that makes this exam very different and unique exam.
Absolutely.
And it's not like about reading too much. However, you should know the topic, what actually they are asking and why they are asking, just to make you a very safe doctor and you don't miss the red flags.
Right. So maybe we will again discuss the details of Plab Part 1 and Plab Part 2 in relation to how we are going to structure our courses for the same. And I will probably go to a next very important question is, do we need to go to UK to give this exam?
Right. So if we'll see, the Plab-1 exam is done across the globe. There are many centers. Even in India, you will find New Delhi, Mumbai, Chennai. There are different centers. In Dubai, there is a center. So a lot of centers all over the globe for Plab-1. Whereas for Plab-2, you have to go to the UK, because it is done in Manchester in General Medical Council. They have two buildings, Hardman Square and the other building, where they take this exam as a OSCE exam. Hardman Square and Hardman Street, both buildings, opposite each other in the GMC complex. And you have 16 rooms, 18 rooms in total, where 2 rooms are like rest stations where you can relax, have a cup of water or tea, and just, do some breathing exercise to calm you down. Rest 16 stations, you will find a patient who is actually an actor, acting like a patient with all those signs and symptoms. There is another doctor who is your examiner sitting just next there, and you enter the room and you perform the task given to you, like history taking, asking the leading question, guiding the management, and you are a junior doctor. So with that knowledge, you take the history from the patient, and then you complete that particular station. So there are 16 OSCE stations, and the best part is that they are judging you on the knowledge of the day of other students giving this exam. So there will be so many doctors giving this exam on that particular day, and the average performance, the average marks every doctor is getting, accordingly you will also pass this. So it's not like there is a framework that out of 16 stations you are supposed to pass 14, 15, something like that. But on the day average, they'll pass you. GMC wants to ensure that they are not there to trouble you on any part. They actually want good international doctors to join the NHS, and they'll help you at every step. You will see there is a proper blueprint available on the GMC website. They'll guide you at every step, and they actually want you to perform the way you perform in your normal clinics on your normal day. You definitely need to get some training, but you need not to mug up any scenario, because you just have to act the way you are a natural doctor and talking to a patient. Actually, you are a doctor. So just with that empathetic, compassionate approach, you talk to the patients, and we can guarantee you,
yes,
you can do very good in this exam.
Excellent. Excellent. So that brings me to the next question, that going by the Plab-2 results, you about 13,000 gave it last year, 14,000 almost, Plab Part 2, and only 8,775 passed. Although this is a better than what happened in 2021, the pass percentage is increasing, but still it is almost, I won't say 50%, but almost 40% of the students are not clearing. So do you see any distinct advantage? Because students may say we would like to go, initially we had USMLE had the CS exam and students used to go and practice for it in the US before they gave it. Plab still maintains the OSCE exams, and we want to know, is there any distinct advantage of doing this, the preparation here in India before you go to the UK to take this exam?
Right. So, I mean, I'm interacting with all the doctors. You must be performing very good in your life, in your career. And every exam is an exam of your mindset actually, in what kind of mindset you are giving this exam. So you should always have that winning attitude, I would say. So you take positive about any exam you are going to give. That is the key, because if you'll see, a lot of students are passing this exam also. So see that category, a highest percentage passing this exam in one shot. So what is actually required is like you have to be, very confident and calm, just like you are doctor on your normal days. I have seen a lot of students who fail this exam are very nervous, especially on the day of the exam. A lot of anxiety related to this, traveling, because for Plab Part 2 they have to go to the UK, they have to stay there. Most of the students, they opt for some academy, practice there for 10-15 days, then practice with other international doctors, and then give this exam. So a lot of cost involvement, anxiety and stuff. So that's what we thought of, discussing with DAMS, Delhi Academy of Medical Sciences. Dr. Sethi and Dr. Mala Srinivasan were very kind to support this initiative and make it one of its kind exclusive course in India, where you can save you a lot of money instead of traveling to the UK, all that anxiety, booking accommodation, traveling, all sort of things. That too you are managing all on your own.
Right.
That too in a different country where there is no one to support you. Sometimes this could be overwhelming.
Absolutely.
So if you prepare here in India, there are higher chances, I would say,
of you clearing,
for you to, be
Yes.
more confident about what
Clearing.
all, things are there. Because you go there, I have seen international doctors struggling to book a hotel. That comes very costly. Or you book another property where you have to give deposit and stuff. So too many things. And when you are going for a short trip, if you don't have a friend or a family there, you struggle. So all those fears and anxiety related to this exam, I would say, if you cut it down, so I think there are higher chances.
Right.
Plus you need some preparation. You need to know what are nice guidelines, how is the setup for a junior doctor in the UK. They are testing you accordingly. So I would say, little preparation.
And also we are going to be doing it the proper way, like it is done in the UK, like with the proper, the mannequins, the Siemens and everything, exactly the way it is done in the UK. It's not like we're going to compromise on that. So if you have people working there who are actually clinicians, because it's important to be taught by clinicians and not theory, which is taught by many places that I have seen online. When I, started working and researching on Plab, I saw a good number of people were trying to do, work which is more theoretical based than people who are clinicians who can teach. So Dr. Shubhank as well as Dr. Karam, who's going to be joining us very shortly, will also be, training you on the SIMMEN directly, just like it is in the UK. So it is definitely a one of its kind opportunity that you have in India, and that too with your trusted name like DAMS behind this whole thing. I'm sure that it would be a good use to most of your students. So please enroll quickly. You will have all the numbers that we will be putting it at the end of this webinar. We'll put you the numbers and you can just enroll with us. Let us know, because our live courses are starting from the 22nd of this month. We are doing a 3-day program, which is going to be just a quick crash course kind of a thing with the Siemens, and Dr. Shubhank as well as Dr. Karam and Dr. Anjum also will be trying to train you exactly like it is supposed to be done in the real exam. Okay, so I would really be happy for students to start putting out your questions, your individual questions right now, so that we can start taking help of Dr. Shubhank to answer your journey based questions on this. Meanwhile, Dr. Shubhank, could you throw us some light on the job opportunities in the UK, and how, which are the subjects which are easier to get, what else is required apart from just the the exams to make sure that you get a job in the UK?
Right. So I would say, like, once you pass your Plab-2 exam, you apply for your GMC license, and after that you start applying for jobs on NHS UK, Health Jobs UK, track application, where you make your online application and you start applying for jobs like FY2, Trust Grade Registrar, SHO, Clinical Fellow, Junior Clinical Fellow. If you have good experience, you can even apply for Senior Clinical Fellow or Registrar post depending upon your experience. And I would say you should always check the job description, what they are actually asking, what kind of duties they are expecting from you, what kind of clinical expertise is required. If you have already done membership exams like MRCP, MRCS, then you can find jobs in that particular specialty. Like you can apply for registrar level jobs in general internal medicine, infectious diseases, gastroenterology, cardiology, whatever kind of experience you have back in your home country. Or you can even apply for the training jobs directly, but usually international doctors find it overwhelming to straight away start the training job, so they apply for non-training jobs first, be there for some time, experience the NHS system, because this would be a little different. I'm saying, like, most of us study medicine from Oxford or Cambridge medical books, so you must be aware of most of the international standards, but still going to a different country, there are particular guidelines, especially antibiotic use and other ethical scenarios which may be different in your country. So to be a safe doctor, it's always good that you understand the system there, and after passing this exam at least you can understand the basic scenarios which you would encounter as a doctor in your first job. So a lot of students even feel like there is saturation of jobs and you won't get training and things like that. I don't think so there is any such discrimination. If you are applying, if you are reading the job description properly, you are tailoring your CV according to the requirement, and fulfilling all the requirements, then there are higher chances for you to receive the job offer. And you will see a lot of international medical graduates working in the NHS system and getting training posts and doing very good in life. And definitely sometimes as a doctor things could be challenging for you, your work-life balance or so. So UK gives you this opportunity. You usually start your work as 40 hours per week, and you'll get a better this thing in terms of salary and everything. Rest about your job application, we'll definitely try to make some more videos, like how you can prepare yourself for the NHS job interviews, what are the common frequently asked questions, how you can tailor your CV, what are the things you can do back in your home country to help you have more points in your CV. And this whole journey gives you good confidence, like interacting with doctors coming from different parts of the globe. Like, it's not you coming from, say, India or Pakistan or Iraq or Nepal, Bangladesh. You will find doctors from Philippines, Egypt, even from the Europe coming there to work and learning, and you get very good training there, I would say.
Absolutely. So I mean, there are already questions that students have started taking. Of course, one very important thing that we missed out on our FAQs is the cost that it would take for a student to start preparing for Plab and then finally getting a job in the UK. How easy it is to get jobs in the UK, and will be at some point in our association with DAMS, would you be in a position to help students, guide them to get jobs in
Definitely,
the UK as well?
we are trying to make this whole program. If you'll see, there are no such Plab-1 courses, to be honest, where you just have few question banks to practice. And sometimes doctors who are in their internship preparing for this exam or are in jobs, it's very difficult for them to only answer those questions and practice with the Q bank. You really need some part of teaching, some discussion, because there are different ways you can learn things and keep it in your mind, is like by practicing and discussing. So that sort of support system we are trying to create here in India, so that you have classroom discussions on different Q banks and important topics frequently asked. We will not be telling you any model answers, to be honest, because of the guidelines we all doctors follow, but we would be telling you the important scenarios which you should know which you may encounter when you start your job and the
Absolutely.
training.
Makes your path easier.
Yeah, yeah.
So
And
we have quite a few FMGs here who are probably interested in knowing a few things. So I'm going to club the questions. The questions are that firstly, do you need to have internship, or do you need to clear the FMGE exam to get Plab, to
Right.
get into Plab?
Right, because you have to, have your license back in your home country. I'm not very sure, like
No,
FMGs.
this I think
yeah,
it is because I know for USMLE for sure that you do not need to, if you are a part of the World Directory of Medical Schools, even for Plab, the same pathway of registration is there with the ECFMG.
Yeah.
So if your medical college outside of India is eligible and it is, a part of that World Directory of Medical Schools, you are still eligible to give your Plab Part 1 exam without having to clear FMGE or do an internship in India. And that because I know, because this is exactly how it works for USMLE as well. Okay?
Yeah, so you have to check that because
Unless the things have changed. So we will get back to you regarding this. So
Yeah.
what is a parallel degree to MS General Surgery in UK? Is there a parallel degree to that?
That is MRCS exams, because there is no MD-MS kind of system like you have back in your home country. You give you join the training in that specialty and you give membership exams of the Royal College. Like if you are in the medical specialties, you give MRCP. If you are in surgical specialties, you give MRCS, MRCOG, your pediatrics one, MRChem for emergency medicine, your anesthesia one. So you give these membership exams, and then finally you work in that specialty for few years. You get all your competencies signed and you give CCT, the final exam, when that's a kind of an exit exam where you get your specialty registration. You also asked me about the cost. So roughly I should tell you, like for IELTS exam you spend like Indian currency 16,000 rupees, somewhat like 160 GBP. For OET you require some 332 pounds, so that is approximately 33,000 rupees. For Plab-1 you would require 247 pounds, that is roughly 25,000 rupees. Plab-2 you require around 90,000 rupees. There could be some costs involved in your traveling to the UK for your Plab-2 exam, your stay, accommodation for some time, and the visa cost. So what we are trying to cut short is all your practice costs, like if you are planning to go there, stay there for a month just to practice for Plab-2 or so. With this course we'll ensure that all that is done here in India, and you can really save a lot of money, because we can understand as a budding doctor when you're starting your journey or you are in a job, you don't have that much of savings, so that could be very helpful. And if you compare the cost of USMLE, UK, MRCP exam, you will find this is more affordable for any junior doctor to start with, because the cost is not that high.
It's not that high.
Yeah,
That's
and
true.
even the duration of you getting
the length of the journey is at
that
least
window
much
period
shorter,
is short,
because the number of exams are also less and
right.
easier to clear. So there is one question that the student is asking is, when do you choose your branch? When do you need to know what is the subject that you want to work with the Plab Part 1?
So for like Plab-1 and Plab-2, these are basics. You just give this exam and you get a basic license. There was a question like whether you should do internship back in your home country. You can even do internship in the UK. You have to apply for FY1, FY2 post. They call FY1, FY2 as internship. If you have done 1 year internship back in your home country, you need not to repeat internship there, so you can directly start your job as SHO, trust gate doctor, junior clinical fellow. The question about the specialty, when we would advise you to start in non-training job. Don't directly join the training, you do non-training job, and then you see, after talking to colleagues there, understanding the subject, the kind of workload and everything, the whole training pathway and everything, then you choose the specialty you want to. And mostly you will find the international doctors joining departments like emergency medicine, general internal medicine, respiratory medicine to start with, to gain that experience which is required for equivalent to the foundation year doctors there. There could be some difference in the terminology, the way you give orders, clinical orders and everything, which you should learn there when you are there. And then you can choose, like it's now very easy. You would find a lot of international doctors doing specialty training even in cardiology, surgery, whatever specialty you want to choose. So that sort of option is always available. For medicine training, you have like usually interview based selection. So you can straight away try to join after fulfilling your competencies, core medical training, and then can specialize in nephrology, cardiology, gastroenterology, respiratory medicine, rheumatology, and during that time you can give your membership exams of the Royal College.
Right. So we have so many questions. So we'll quickly go over them. Are the UK degrees valid in India?
Definitely. Your UK degrees as such, if you complete your CCT and all, and if you want, you are a consultant in the UK, you want to come back to India and practice as a consultant, definitely you will find all over India, you will find a lot of doctors who have, you know, done their specialty training CCT back in the UK, and now they are in very good positions in, you know, most of the corporate hospital in India.
Right. How many years will it take to complete this whole process? Like if you're an MBBS graduate, how long will it take for you to finally settle in the UK?
Right. So first, as I told you, you get your EC FMG certification done. Give your English exam. So like if you do nice preparation, it should take 4 to 6 weeks for you to pass this English exam and get the required score. Then you book your Plab-1. There could be delay in the booking sometimes if the seat is not available. But now GMC is trying to create more and more seats because soon they are going to launch USMLE instead of Plab exams.
Right.
And once you pass your Plab exam, you can straight away book your Plab-2 exam. So I would say, like, if you are lucky, it should take like 6 months or so clearing everything. And
clearing both the exams?
Yeah, both the exams.
Oh, that seems quite, I think in the USMLE, I would say 6 months per step, which is 3 steps at least they have to do.
It takes some time getting the seats, you know, sometimes seats are not available and all that traveling.
Is it getting better? Would you say it's getting a little better to
Definitely, GMC always tries its best to, you know, bring new strategies. During COVID also, when there were a lot of issues in the traveling of international doctors, they tried bringing more seats. That's what, like this, they have 2 centers now, they have multiple dates available for all these exams. Plab-1 is conducted 4 times in the UK. All over the world, it's I think 2 times. They are, you know, increasing seats regularly on this. So they even want a lot of IMGs to come and registered with GMC. So process, if you would compare to other foreign exams like USMLE or Australian Medical Council exam or Canadian one, you will find this is much easier for you.
Shorter and probably cheaper, I would say. Right?
Most affordable.
Fine. So is the FMG preparation going to help me in Plab, or is the course completely different? So these are a lot of students who are from foreign universities who are in India right now, and they are wondering if one course will suffice for both the exams. So what do you say?
So I would say medicine remains the same. Diseases remains the same. There could be some new ethical scenarios which you would be learning from this course and that's why you have these kind of courses. These courses are always there to help you out, you know. These courses can guide you exactly like what you have to study, because you have studied medicine from the textbook, Indian textbooks, or, you know, international authors. You have done a lot of deep study during your MBBS exam, because at that time you were studying in detail. But now it's like very focused study about the common clinical scenarios which are available there for a junior doctor to learn and then pass this exam. So I would say this kind of coaching, you know, 10-day coaching, like we have designed this Plab-1 course, crash course for Plab-2 who want to practice, and there'll be a detailed course also. So these kind of courses are there to help you basically, so that actually you understand like what you should not study, to be honest.
Absolutely,
like,
that is exactly what I was saying, that instead of going into depth, it will actually make things easier for you by cutting out things that are not important. When you do FMGE exam, it will focus on certain other things that you need to know better, whereas the Plab exam is quite a easier exam for people who are in the junior doctor category. They're also clinical oriented, just like the USMLE. In fact, I do think a lot of students who have given USMLE tell clearing Plab is a cakewalk for them. So even then, overlapping of exam preparation is something I never recommend, and especially when it is a 10-day course. You know, I think you might as well just go ahead and do that course, and at least it will give you clarity on the things that you need to do. So I mean, I think I would answer it on your behalf that don't mix 2 courses.
Right. No, I was listening to, sorry to interrupt, to Dr. Sethi, the introductory video. He beautifully said that DAMS wants to be a trusted trusted partner
Yes.
for your journey, whatever you want to choose. Like some doctors have this ambition of practicing medicine in the US, UK,
Everywhere,
India. So
anywhere.
at least you have everything available,
Yes.
and then you can select the best option for you.
But the FMG, I mean, you're very right that you do have to clear FMG because you feel at some point in time you may want to come back to India. So you do have to give 2 exams for sure, you know, and that is why there is a confusion whether studying for just this will suffice. But I would say take that extra effort and do it properly, because if you do it the right way, it will go a long way for you. Okay. How to make a good CV, and do we need research or to publish papers for a good CV?
Correct. So for the UK jobs, if you'll see, like the UK based doctors, the doctors who are studying there in the UK, their CV, there are a few things which they always do is like audits, quality improvement projects, some sort of research and teaching, and some sort of volunteering. So these kind of 5 things which can add on, and you will see a lot of application, NHS jobs application, where they would expect you if you have done it. So I think you should read about like what is clinical audit, what is a quality improvement project. If you can do something back in your home country during your internship or after your internship. Some students prepare their CV and do some sort of volunteer work that can even help you, some sort of teaching to undergraduate students, nurses, your juniors in the medical school, and getting some documentation also of that, attending conferences and any sort of research happening. If you can write few papers, some publications, if you can assist in some sort of clinical trials or research happening around you in the hospital where you are working, so that can really help you to build a better CV. And attending conferences and CMEs, that really helps you. There are a lot of online courses available which you could do to show like you are very academically oriented and very interested in that particular field. For example, if you want to pursue cardiology further, you can do courses on cardiology and you can make your CV impressive for the clinician, seeing your CV that you have more courses, online courses, etc. done in the field of cardiology, and you have work experience also working in the specialty of cardiology, that can later help you to choose this specialty, and this gives you a higher advantage in comparison to other students.
Right. So which are the possible pathways for postgraduate diploma specialization and family or community medicine specialty courses in UK?
So there are different ways with which you can go for GMC registration. First and the most preferred one is the Plab pathway. You will see giving English exam, Plab-1 and Plab-2. Other is the MRCP or Royal College examinations, like as I said, MRChem for emergency medicine, for medicine MRCP, for surgery MRCS, MRCOG for OBGYN, MRC pediatrics. So these are different things you can do. Third thing is MTI. If you'll go to Medical Training Initiative Royal College website, you will see a lot of MTI posts. So if you are a doctor with Indian postgraduate degree, diploma or experience in that specialty, you can apply for these MTI posts. These posts are usually for 2 years, and you can go to the UK, learn from the system and come back to your home country. Other than that, there are different other courses also. For example, some universities have started MSCs also, 1 year diploma course also, masters in medicine and these kind of courses also, which can help you out. For doctors who are in the field of community medicine, you can do masters in public health. Many doctors who just want to go into the field of administration, they can do MBA and MPH, these kind of things also, if they plan to work in the UK, not as a doctor but in different specialities. But if you want to work as a doctor, then I think the best preferred route for you is Plab and then Royal College examination. Royal College examination, you need little more experience, little more focus study, so that also you can do while working. Like if you're working in general internal medicine and have exposure of all the specialties, you can write that. If you're working in a hospital in surgical department, you can prepare for MRCS. Same way for MRChem in emergency medicine or OBGYN when you are there and you have already done specialization here. So these pathways are always available for you and you can choose accordingly. And if you will see like what most of the IMG prefers, then this is like Plab pathway.
Okay, that's great. So most of the students are asking, is it true that Plab is going to be discontinued, and could you say something about the UKMLE pathway?
Correct.
What difference will be there between the two?
So I mean, for all doctors, medicine always remains the same, So we all know that the diseases, the way you treat, everything remains same all over the world, and medicine is universal. Like wherever you go, you will find your colleagues working in Australia, Canada, the USA, the UK, back here in India or different other Asian countries. Medicine remains the same. They may change some sort of, the pattern of this exam, and they call it UK Medical Licensing exam, UKMLA, instead of Plab. There'll be definitely two parts of it, like Plab-1 and Plab-2. And if you want to read details on this, you can go on the GMC website. They have clearly, stated everything about UKMLA, and they will definitely announce from when they are going to launch this. And the course outline, there'll be a blueprint. Like if you will find on the GMC website, there is a blueprint for Plab-1 and Plab-2, where you have the detailed syllabus, like what are the clinical scenarios they'll be covering, which are like the most common clinical scenarios you find when you are working in the ward or in the emergency department of any hospital all over the world. So these are like the basic thing, and most students prepare from the Oxford Handbook of Clinical Medicine. So these are some handbooks which can help you to learn some sort of algorithms and flow chart. So those kind of books can also be very helpful for you when you are preparing. And you can choose like according to your need, your requirement, and after talking to colleagues and any sort of confusion you have, query you have, you can always reach out to DAMS. We'll be showcasing all the numbers and contact details for your individual questions if you have any.
Absolutely. So a student has asked, which I missed the question somewhere ahead, that does a Plab-2, after finishing Plab-1, you clear Plab-2, will you automatically get the GMC license, or do we have to do something else to get that license and come back to India? I mean, or do we have to come back to India? What about the visas? Like what kind of visas are we eligible to go for initially, and then for the work, do we have another visa that you have?
Right, like Plab-1 you can give in your home country.
Yeah.
If you want to travel, you can travel even for Plab-1. But for Plab-2, like there is no other option because it's mandatory. You give in the Manchester, in the UK, in the General Medical Council, either Hardman Square or Street Building. Now the visa issued when you are going for the Plab-2 is visit visa, right? So you are going at that time on the visit visa, and you specify like when you are going after giving exam, after like spending a week, 2 week, whatever, meeting your friends and relatives, you come back. And then you apply after your GMC license, you give interviews, and when you are selected, the hospital gives you a certificate of sponsorship. On the basis of that, now you apply for tier 2 health and care visa. So this visa is for the healthcare workers, doctors, healthcare professionals, and now you go on a tier 2 visa, which is a job visa. So this visa is different from the visit visa. Like on the visit visa, you cannot do any job. You're just going there to give your Plab exam and come back. Whereas on the job visa, health and care visa, you are getting a letter, a sponsorship letter from your NHS hospital, the trust where you have applied and given the interview, and then you can go on that visa.
Yeah, so last time we had Ms. Jo Bedford, who had come from one of the private organizations who recruit doctors, and she mentioned the same thing, that once we have all your paperwork done, it takes a few months for them to process the job visa.
Yeah, 4 to 6 weeks, like you keep in your mind, like after clearing your interviews and everything, it should take like 4 to 6 weeks, maximum 8 weeks. That's it, like.
Right. So how is how is doing PG in UK different from that in India?
So PG, as I said, that it's not like MD MS course here in the UK where you are there for 3 years, you finish the course, you join the training, and during that training you give your Royal College exams like MRCP, MRCS, or there are different routes also available, like this CESR route or the CCT route, where you complete your core training and you give the exit exam. So there, when you are in the training, you have different routes available. Many doctors even opt like not to do training, they go for GP training. So that is like very very much in demand, I would say, among the Asians.
In fact, we
you will
have
find,
Dr. Karam, who is one of our educators. Dr. Karam Singh is a general practitioner.
Right. So you have a lot of opportunities to be a GP, general practitioner in the community, where you're not working in the hospital, you're working in the community, and that is also an option. So a lot of options available. Either you take CESR route or CCT route, you give your Royal College exams during that time, and a lot of training post available for you.
Right. If we do PG in some other countries of Europe, like Germany or France, then can we apply for further subspecialty courses or job as a PG doctor in UK through GMC direct registration pathway without Plab?
No, that's what I told you, that the pathways remains the same for you to apply for the GMC. Either you go give Plab exams, or you give Royal College exams, or you go via MTI. Whatever PG degree you have, the MD, MS, or any degree from Germany or Europe, that I believe would be considered as an experience in that particular field, right? Because the UK training pattern is different from other countries. So I would say, like, if you have done that, so apply for the jobs. See, in some jobs, for example, they are looking for that kind of experience, like 3 years experience, 4-year experience, 5-year experience as ST3, ST4 jobs. So that you can apply accordingly. So these degrees are not going to give you extra advantage, I would say, but
you have to
definitely
go through the same pathway.
Yeah, you require the GMC.
This is a very interesting question a student has asked, that is it compulsory to do a specialization, or you can just work on as a junior doctor throughout?
No, definitely it depends on you. Like, some doctors like do locum, some doctors finish their training, some doctors go towards the GP pathway. There are many colleagues of mine who go to Australia then from the US. So there are different options always available for you.
Yeah, that's good. How many times in the year is Plab arranged in India?
So Plab is, like, I think 2 times in India. I literally have to check on the GMC website. However, in the UK it's for 4 times.
4 times in UK, but it is twice, I think, in India as well. Now, what is the duration of non-training program?
You can, like, when you are applying for the jobs, you will see the duration is for 6 months or 12 months. Usually you join any job in the US, in the NHS, for like 6 months, and then you can apply for the training jobs. And in between, if you are getting a training post, you can speak to your clinical supervisor, educational supervisor there, and then take further decisions. So if you fail
in Plab, how many chances do you have to clear this exam?
You get, I think, 4 attempts for Plab-1 and 4 attempts for Plab-2 also.
Yeah. Can we go directly after internship for a job to UK and then give your Plab-1 as you get a job there? Is it possible?
No. You have to have the GMC license. You can definitely go on a visit visa to prepare for Plab there.
At least for the NHS, but there are some non-NHS jobs that Joe was telling the other time.
All the jobs, you have to have the GMC license.
GMC
that
license,
is a mandatory thing.
Yes.
So that GMC license can only come either by Plab, Royal College, or MTI. So directly you can't go. You can't work as a doctor. You will require a GMC license to work as a doctor.
Okay. So that answers that majority of the questions. How many years does it take to complete super specialization in the UK?
So it depends, like, the super specialization also is like your journey from the junior doctor to becoming a consultant in that particular specialty. So for example, like, you join, say, one specialty and you do the training job there, and you work there for like 6 to 7 years and give your Royal College exam, specialty exam during that time, and then once your competencies are fulfilled, then you apply for the CCT, you give this exam, and then you qualify to be a consultant. So there is no specified time period in general I can say to you, but definitely we can make a separate this thing for different specialty wise, like for OBGYN it's different, for acute medicine is different, for surgical specialties it's different. It varies from specialty to specialty, but we would like to do in future a video about.
We'll make all the possible courses which are very popular from the students, and we'll try and get you the answer to the pathway for the entire process. Okay. This FMG question is coming on a lot, whether you need to first clear the FMG, whether you need to do an internship before you can apply for Plab. So I think what we are going to do is we'll make sure that we
We'll
will
find
go
it
over
out.
these, things again, and we will put it out again to each of you who have asked this question. At the end of this video, or probably a special link, or maybe another separate video can be made for the FMGs. Even Dr. Shumang can come over.
Correct. We need to
And we'll
find
make
out.
a small pathway for the FMGs and what are the different registration processes, so that you can simply follow those guidelines. So let us get back to you regarding the entire process. Whether if you are a foreign medical graduate, when you say foreign medical for India, those who live and stay in India but have done their MBBS abroad, whether they need to clear the Indian registration. Like I mentioned, it is probably not useful for the USMLE, but again for Plab, we will get back to you regarding that question. Okay. We need to make sure that whatever we are saying is completely authentic and you will not have any problems after that.
Yeah.
How much is the approximate stipend per month for PG courses and also for super specialty courses? Are they different?
Yeah, so that's what, doctor, you have to first understand that, they don't call it like a PG or something like that. It's like either you are going into a training job or you are going into a non-training job.
Okay.
Right? If you are going into a non-training job, then, it depends, like there is a range according to your experience. You may get somewhat like maybe 35,000 pound a year or more, and according to your experience it could be like even 50,000. That I'm talking about the basic salary. Obviously there'll be some tax deduction, but then you get some out of social hours extra when you are working weekend on call or so. I would, a good
Quite
handsome amount you receive as a doctor there.
Comfortable for
Yeah.
yourself and maybe your family also?
Yeah, definitely you can work on it. And then once you are into the training, then it depends, like from different training according to your experience and everything. And you get almost the similar basic salary, and rest depends on your out of social hours, weekend, and bank holidays when you are working, so you get little extra. So and when you are like doing your super specialization also, it's not like you can't compare it from India. The work experience you have, accordingly it goes on adding to your this thing basic salary, and that helps you. Like it's not like a fixed amount. It really depends from individual to individual.
Pretty comfortable for not only the
Yeah.
student but also a couple of family members.
Yeah, mostly doctors they go as a couple.
As a couple, then because most of them go after their graduation here, right? Also, for choosing your specialty, how do you select that specialty? Again, this question is being asked, but this time the student is asking, is there an exam like NEET, PG, or a rank list that decides your specialty? Like for USMLE, if you have great scores, and your CV is very strong, then you can get into specialities which are more in demand. So does Plab have something like that, or you can just go into any specialty?
So Plab is a basic exam. For after that you receive your GMC license and you are eligible to work as a doctor in the UK. Right? When you further want to do your training in particular specialty, then you get different exams. Those are MSRA exams. And then accordingly you choose which specialty you want to go for, either GP route, or you want to go for like surgical training or medical training. So that whole pathway is different. And then it depends from person to person. It depends on your interest, to be honest. Like you can't really compare, because it depends on the person's choice. Like somebody wants to be a GP, so this is his choice. He like working in community, want to see such patients coming with common ailments and then referring the sick patients. And also it's their own interest. Like you have to choose the specialty where you want to work whole of your life. So accordingly you choose, like whether you want to be a surgeon, you want to be a physician, a GP, or a specialist, because whole life you will be working in that particular specialty, and you have to love your profession. That's the only way of staying happy and motivated.
Absolutely.
So whichever specialty you choose there, it really depends on your interest and your own motivation.
Right.
And there are a lot of options available.
Sure. So the question I think I will ask you now is that you can choose the specialty you like. For example, in India, we have huge number of people wanting to do surgery, dermatology, maybe orthopedic, plastic surgery, and they do not go to the US because these specialties are very difficult to get by. So if I have a passion for surgery, or if I have a passion for dermatology, do you think if I just follow the pathway, it will be easier, or are some specialties more tough to get than others?
Definitely these specialties are competitive worldwide. If you'll talk about dermatology, if you'll talk about some surgical specialties like
Radiology?
cardiovascular,
Okay.
so definitely when in radiology there is competition. Competition is always there, but then it really depends in the interviews about your interest. If you're really interested and passionate, here I would just say that theory of vibration. If you really want to achieve something, you work hard towards that and you achieve that goal. So it really depends on your interest and the hard work you are doing and the sort of experiences you are gaining. For example, if somebody wants to be a cardiologist, you do a lot of courses in cardiology, you gain more experience in cardiology, so your CV becomes more towards cardiology, and when you are applying for cardiology training, there are higher chances because you are showing to the panel that you are very keen towards cardiology and you have tried your level best to be upgraded in the specialty of cardiology. So that really helps. In the similar way, you can show, like if you have interest in dermatology, some publications in dermatology, some sort of experience in dermatology, some sort of interest in dermatological cancers, etc., which you can really show. But definitely some specialties are competitive, and I mean, everyone is like a common human being like us. So if they can do, then definitely you can also
Anyone
do.
can
So
do it, absolutely.
there is no difficulty in choosing that.
I think a lot of students are asking if you had mentioned some online courses to improve your CV. Do you have any list of acceptable online courses, since there is so much of confusion regarding which ones are good and which are not so good?
So I would say, like there is no such differentiation, to be honest,
Okay.
but you can do online courses from different reputed international universities, whether these are paid courses or unpaid courses. You can do a lot of courses from GMC, sorry, from NHS hospitals also. Lot of UK universities run medical courses. There are different webinars happening, online courses happening, 2-day courses, some sort of, everything is now there. So accordingly you can choose. There is no such differentiation, and these courses are not going to give you something additional, but definitely some sort of thing in your CV to showcase to the panel. Like for example, you want to pursue oncology further and you have done some some research, some publications in oncology, some sort of courses in oncology. So definitely you get like
we
a
will
higher,
probably send you all a link. What we can do is make either a Facebook or an Instagram group for Plab
where we
courses
can
and
definitely
DAMS, where you all can interact with us individually, and we can start sharing
some
to
links with
places
you.
which are where you can apply for online courses which are viable, application processes, anything that you need to ask. With all the experts, we will be there on the group with you, and we can individually answer your questions. Very shortly, I will share one of the groups like that. Okay. UKFP, there is a student who wants to know about UKFP, and also whether the GMC license can be used in other countries around the world to work as a doctor.
So FP, you mean to say family practice?
Probably family.
Are you asking about
what
GP?
Is UKFP?
Please
Can
clear
you just
that.
specify what is UKFP you're talking about? Okay, Dr. Anush. And whether this license can be used to practice around the
So
world.
GMC license is for you to practice in the UK, but definitely your UK experience is helpful. Like many doctors opt to join Australia. So if you have experience of working in the UK, you can work in Australia. You can even get some training post there. Similarly, in UAE also they accept, and many other countries. If you have UK experience after receiving your license, so every country has different guidelines, like for how many years you need that clinical experience. So if you have those competencies signed, if you have experience of the UK, definitely you can work in different parts of the globe.
Okay, so again, the students about the timeline, that how long will it take to clear Plab part 1, part 2, and finally reach there for a job, whether it is a simple job, and then finally how much time from the job to a specialist. Like very clearly they want a timeline for it, from part 1 how much time it takes, then part 2, including the process of application.
Correct.
What is a ballpark?
So I can tell you the average, because it's like it depends from person to person. For example, you have finished your medical school back in your home country, you have finished your internship, that means you are at the level of FY1, FY2. Now you first write the English exam. For all international medical graduates, first mandatory thing is English exam, OET or IELTS. You give that. When you get that particular band, that score, now you can book your Plab-1 exam. Now preparation of IELTS or OET, usually it takes like 2 to 3 weeks maximum.
Yeah.
You
okay.
can keep it in worst case scenario like 4 weeks, in best case scenario 2 weeks. And when you book your Plab-1 exam, from that booking to giving this exam, most students I find, like my colleagues, they take like 4 to 6 weeks to prepare.
Okay.
Or maximum you can keep it, like if you are working, you keep it like 8 weeks. So just 2 months should be enough for you to prepare for Plab-1. Okay. These kind of courses may really help you to expedite your whole process of learning. Like in a 10-day crash course, when you are able to interact with faculty, discuss all your doubts and do the relevant questions, and hit on the important topics which are like frequently asked, definitely it will take lesser time. So I would say roughly you take 4 to 6 weeks. Okay. And if you are working professional, some family things, if you have to see a small child and things like that, then maybe keep it 8 weeks, should be more than enough. Once you pass your Plab-1, then you have to book your Plab-2. And for Plab-2, I would say, like earlier the situation was everyone has to travel to the UK to prepare there, then give exams. I see many students, they pass even without any sort of academy. And but definitely you need a group of colleagues to support each other, so that you can practice these stations, because these are the stations where obviously there is a patient is telling you all the problems they have, and you are taking the history from the patient. Another doctor is an examiner. So in the same way, if you have a group, so you can practice and you can ask each other and observe each other, how you can improve that interpersonal skills and those scenarios you learn. So when we are bringing this course in India, this was the whole thought, so that this whole struggle of traveling to the UK, waiting for your visa and everything, that is cut short. Like you need not to wait for another 6 months or 8 months just to go there, book course, and all that struggle.
People of almost a year and a half, even 2 years to clear the exam with lot of expenses,
because
which is uncalled for, frankly.
Right, all that can be saved. You do the Plab-2 course here itself. Be confident, practice everything on the Simmons and Mannequins, have discussion groups, and once you are confident, then you are traveling just for your exam. You just go there for a week or less, give your exam, meet your friends and family, and then come back. So your whole journey is like cut short. You are more confident after practicing here back in your country. No such struggle of booking accommodation, arranging for food, traveling, visa, etc. I mean, all those delays can be avoided. So I would say after passing Plab-1, it should take you 6 to 8 weeks maximum. So that's what I'm saying, like
but
in total 6 weeks.
The application has to be done in advance, right? For all these, the application process, because you have to pass Plab-1, apply for Plab Part 2, the application process must be taking some time. So
it's stepwise. Okay. Like first you have to pass English, and then only you can give Plab-1. If you pass Plab-1, then only you can give Plab-2.
Apply for Plab-2. So you have to just combine the study, the application part. I think 1 to 1.5 years for the entire process probably.
I would say in best case scenario is 6 months. In worst case scenario, it's like 1 year.
1 year. Okay. He says by 1 year you can do it, which is pretty good actually.
Most of the students you would find like they completed the thing within a year.
That's nice.
It really depends on the seat availability for Plab-2, this thing. But definitely GMC is trying to arrange more and more seats, and you are getting seats to give this exam.
Right. This is a very unusual question. I would like to know this. If a student failed step 2, USMLE step 2, can his USMLE step 1 replace Plab step 1 and directly apply to step 2 with the help of USMLE step 1 passing result? I haven't heard of this one.
So it was not like this, but definitely there is an option. Like when you go to GMC, that's what I'm telling, it is very individual. Like when you go to the GMC website and you check for Plab exam, there is a questionnaire. Which questionnaire you can answer if you have like studied in some universities or countries where they accept your primary medical qualification. There are countries where you are not supposed to give Plab exam at all. You directly get the General Medical Council registration. There are some countries, some universities in the Europe. So that is one pathway. Second is like if you have your USMLE or Australian Medical Council, or I think Canadian Medical Council, you can check. You can ask GMC about that, and you will get a individual answer whether you need to give this exam or not. I haven't heard anyone giving just one part, to be honest. Anyone has to be like gets a sponsorship for both the parts, direct GMC license, or like whole exam.
Yeah.
But definitely you have asked, like there are some situations where if you are already registered in some other countries like US and Australia, you can check in the
Yeah.
GMC questionnaire.
That even
Yeah.
I heard, because the previous person, Ms. Joe, had told that if you are already ECFMG certified, where you have finished all your, then there is certain, some exams that you may not need to take. But again, like I said, clearing just one step of USMLE, whether it can replace the Plab Part 1 is again,
Right. It's
is
not
something
like
which is individual. which
part
you can-
wise, to be honest. So
Okay.
far I haven't read anything like that. You just check the GMC website. There is a Plab questionnaire, and you can like see all those questions, and then the page will guide you whether you are supposed to give or not.
Okay. There's a student who is asking for the complete pathway for MS from India. If already finished MS from India, what is the pathway? What do you think would be the best way to go to the UK?
Right. So one pathway is you give your MRCS part 1 and the second part, and during that you apply for the jobs. And but first thing every doctor requires is passing the English exam. So definitely you have to do OET and IELTS with that particular band. And what you could do is just go to NHS jobs or track jobs, health jobs UK, see the jobs availability in the section of medicine, medical jobs, and there are different categories available like clinical fellow, clinical research fellow, junior clinical fellow, trust grade doctor. Just start applying. If you have already done your MS, so this will be counted as your 3 years experience. So you can apply for the jobs such as clinical fellow, specialty doctor, senior clinical fellow. And in the job description, they have given essential criteria and desirable criteria, where they have clearly asked for surgical experience or experience in any particular surgical subspecialty, or MRCS part 1 if you have, so you have higher chances of getting that particular this thing. So I would recommend you going to the health jobs UK or NHS jobs, see in the job criteria. If you have personal query, we'll try to answer that also. You can send it to DAMS and we'll give you the detailed answer
I
for
will
it.
tell you about the
And,
link
yeah.
on which you can send your
Yeah,
questions.
but definitely start preparing for English. That is going to help you for sure, because
Yeah.
that is mandatory whether you take
The
Royal
IELTS
College
or
exam
the
or
OET.
Plab pathway.
And even USMLE actually. OET is mandatory now for USMLE as well. So how do I check if my medical college is eligible to take up Plab? I think if it is the USMLE process, then again it's the World Directory of Medical
Correct.
Schools.
You check on the World Directory of Medical School, and obviously you have to register on ECFMG, and they'll give you that certification that they will directly send it to GMC.
Yes.
And then definitely you can
So
come.
the
Most of the
process
medical
luckily
schools
is overlapping for
most of the
USMLE.
medical schools are on that list.
Right.
Even if your school is not on the list, then there is a process you can write
to get
EC,
it there. Yeah, that's a process
you can
which
write
we can
to
help you with.
ECFMG and
Yeah.
GMC, and
Yeah. After Plab-1, in how much period you have to attempt Plab-2? Can you give it immediately?
like
or?
definitely, like I would recommend you giving it immediately as soon as you receive the seat for Plab-2, and usually like 4 to 6 weeks are more than enough, so that you start preparing simultaneously. Like for example, right now you start preparing for your English exam and Plab-1. Once you clear your English exam, straight away give your Plab-1, and after your Plab-1 start preparing for Plab-2. As soon as you receive your date for Plab-2, just give it. Like there is no point of delaying, because there is so much of demand of this exam that
True.
You need to give this at earliest possible, and your knowledge is also fresh. Like just straight away after giving
So there is
Plab-1,
no set period you have to wait. You can directly
if you get
apply
a seat like within few weeks, then it's
you
ideally.
can
I
get
have
it
seen
as soon as possible.
I have seen many of my friends passing exam just straight away without like much of preparation.
Okay, that's great. What about the certificate variation by GMC after passing Plab-2? Verification, I'm sorry.
Right. So once you pass your Plab-2, like for Royal College exams, students have to specially go to the UK for the verification. Whereas if you are giving Plab-2, that is conducted in the General Medical Council building only. So at that time your identity check is already done. So after you pass your Plab-2, you apply for the GMC license, and here you give all your details, like after MBBS, like where you have worked, all your experiences, if there is a gap, what you were doing at that time, all those references and details you give, and then GMC sends you a mail regarding your license. If they require some more documentation from them, from you. They will send you in the email that they would like to know about, you know, certain things, your academic qualification, experience, etc., that they may ask, and then you get your license.
Right. Does a recommendation letter from college professors help in the CV, or you need better than that? Like, does home
No.
country recommendation help?
Right. So there is no such provision of, like, you definitely need references. So you definitely keep it as references for you. But these recommendation letters are not, like, there is no scope of some added advantage, I would say. What is required as per UK CV is, like I told you, is clinical audit. You need quality improvement project. You need some teaching experience if you have, some sort of training courses you have done, some research and publication, volunteer work, or conferences you have attended. That give you added advantage. If you have some recommendation letter, definitely you can, you know, showcase it when you are applying for the job. But to be honest, I mean, there is no such thing I have found in any application where there is like some extra scoring for it or so.
Okay, all right. So because for USMLE again,
Definitely.
we need a recommendation for clinical work done,
Right,
and
right.
sometimes it's okay to have one letter from India, but the rest of the students prefer that you have to go to the US. Okay, can we go do MRCS directly after your MBBS? Can we
Yes.
directly go for
Yes,
MRCS?
lot of students, they work in the surgical specialties in their home country. They gain some experience and give this exam. Like, you need some basic experience also while working in the surgical specialties.
Okay. And Plab-2, how many times is it organized in a year?
So Plab-2 is organized like in a month. There are various dates available. So they are trying to give you a lot of you know, dates every month. Earlier the number was less, but now they have increased it. So it really varies. There is no fixed number, I would say, but definitely it varies, and you have a lot of options available every month. You know, there are like 3-4 times they are organizing it in a month.
Okay, okay. Can you get a permanent residence of UK during your training course or only after completing it?
I believe for that you need to check it separately with the UK Home Office guidelines, and like if you are in a job for like 4-5 years or so, you can apply for ILR, or if you are in the UK for 10 years, then this is a criteria which you could check.
We could also get a visa counselor probably who has all the rules and regulations, and have another chit chat with a visa counselor who could sort out these small visa issues for you, like what is a visa to go, how to stay on, and finally how to convert it to a permanent visa over there.
Right. So for doctors, the only visa to go is health and care, because you will be sponsored by NHS.
Okay.
So this is the only visa on which you will be traveling.
Okay.
And then you either work for like 5 years or so, and or maybe 10 years of residency in UK, and then you can apply for ILR.
Okay. Okay, UKFP's United Kingdom Foundational Program.
Okay, foundation, that is your FY1, FY2. If you want to go into the foundation training, you can do that. Many IMGs they prefer, because those who want to do training there, specialty training there, they prefer starting from FY1, FY2 their foundation program. So there are foundation program, the vacancies also available. You can apply for that as well. And some students prefer that route if they have not gained like clinical experience back in their home country, and straight away after MBBS want to join there, you know, and gain this experience. So that is also an option.
All right. How would you, after MBBS, what all would you recommend to improve your CV to make sure that you stand a chance to get a good job there?
Right. So I would say, like, after MBBS, complete your internship. During your internship, give your English exam.
Okay.
Right. Start preparing for Plab-1. And during this time, if you could assist in some research happening in your university or hospital, where you can, you know, assist in any sort of, you know, clerical work, any sort of clinical data gathering, etc.
Okay.
That can help you, and some sort of I would say volunteer work if you want to do, that can help you, and some audit if you can do. Like most of the hospitals, corporate hospitals, or even medical colleges gives you an opportunity to do an audit. In audit, you just compare the guidelines, for example, the rate of infection in that particular OT. You can compare it with national guidelines, and you can do some project to improve that. There are I have seen some students doing the patient experience, like like the discharge time taken and the experience with the whole process, if you can help in your hospital or in your ward itself, like with few patients, like your communication actually helped them using some modality, like you introduce tab in your ward and you make the discharge summary, and straight away you help them out so that the whole process is shortened and the patient experience is improved. So that also can help you to.
So any kind of basically hospital patient work, whether it is clinical, even non-clinical, administrative, or
leadership
that kind of
leadership role also you can showcase if you have organized some sort of camps, if you have volunteered somewhere, if you have worked in a care home, geriatric care home, that sort of stuff can also help you. But keep doing the clinical stuff. They prefer like you are continuously in a clinical setup.
Scenario,
so
correct.
yeah, don't leave the clinical work and do something else.
Right.
Whichever specialty you are interested to do your further training, just work in that specialty only for that particular time till you clear all these exams.
Does ACLS and BLS courses help here?
Definitely. These courses you have to do once you receive your license. Better to do the ACLS courses back in UK by the Research Council. So they prefer your ACLS course from there.
Okay. UK FP preparation, not yet now. UK FP preparation we don't have, but is Plab-1 and 2 compulsory for the foundation programs as well?
Yeah, so you can, as an international medical graduate, you have to do Plab-1 and Plab-2. Like this is the only way for you to get a GMC license and then do the foundation years.
Okay. What about a gap in the CV in case you have graduated, and then sometimes a lot of students take some gap for giving exams and doing, understanding what they need to do. Does that gap affect your CV?
Correct. So I would say like be honest in your application, write in detail what you were doing, why there was a gap. Like some people take like maternity leave, like you have to look after your parents, some family issues, or you were preparing for some exams, or like you were traveling, maybe after marriage you were traveling to another country and stuff like that. So clearly mention in your application why you took the gap and what you were doing during that gap, so that like there are no further questions on it. If you clearly state like during this period you were giving, for example, you were giving Indian PG exams, so clearly say you were giving Indian PG exams, and if they ask you about some evidences, then you can send your like the admit cards, because during this year
they're allowed to study during this whole time.
Definitely. A lot of doctors take a gap year. They study for Indian PG exams or USMLE. So be honest in your application and clearly state that. If they require evidence, they'll ask you in email, and you can show your admit cards, etc., what you were doing. And definitely for Plab also, like you are preparing for your English, Plab-1, Plab-2, you can mention that you took the gap.
All right. Is the core training and super specialty in UK equivalent to the MD in India, and can we practice in the same position in India?
Yeah, that's what like initially we covered. If you cover the specialty training there, and either you become consultant through CESR route, or you become consultant after giving CCT, core clinical training, the exit exams, you will find lot of doctors in India or all over the globe, like in UAE, you will find Australia, you will find they are practicing medicine as a consultant. Yeah.
Right. What about Plab expiration of the exams, like 1 and part 2? How long are they valid?
So
the results.
So your English is valid for 2 years. Within 2 years, you have to give your Plab-1 exam.
Right.
Your Plab-1 exam, I believe, is also valid for 2 years. And then within 2 years you have to give your Plab-2 exam. And after Plab-2 exam also, I think the period is for 2 years for you to 2 years, I believe, to apply for the GMC license and to be there in the UK.
If somebody has failed in first or second MBBS courses and has completed in 7 years rather than 5 years, then does it affect the GMC registration or taking the Plab exam?
I don't think so. I mean, once you have finally, it's a course which you have finally passed. What you have to showcase is your degree. And then clearly you state, like they must be, like if they have a question on it, they will definitely ask you when you will put your duration. So I mean, many doctors, they fail in their university exams, so that should not be the criteria whether you are giving any further examination, and definitely you can apply for this exam. No issues
So
with
we
it.
have this question again for choosing of specialty after your Plab part 2. Can we choose the specialty and how can we choose the
Correct,
specialty?
correct. Because you are actually choosing the specialty where you are going to do the job. You search the application, for example, most of the jobs are available in emergency medicine for junior doctors, or general internal medicine, or respiratory medicine. So you choose these specialties where you want to go. Yeah, if you are going for a surgical specialty, if you are having surgical experience, you can go with that. For example, if you are working in, say, OBGYN after your MBBS, you have worked there for 2-3 years. Now you search for some post in OBGYN where they can accept your OBGYN experience. So whether you have experience here or a degree here, which you can show as a clinical experience, right? So if you have like most doctors start with like emergency medicine or general internal medicine, where there are a lot of posts for SHOs and trust graded doctors and FY2 positions. So usually you start from there, and then once you are there in the system, you give your MRSA exams and other exams, and then you can choose the specialty you want to do your training. So now you are applying for training post, and that application is different, where you use Oriel or different platform to apply for the training post. But it is generally recommended that students coming from abroad, like international medical graduates, they should take the this route of first doing non-training job for 6 months and then applying for the training.
Right. Can we also be guided on how to approach the prep as well as the procedure for UK after we finish PG in India?
Right, definitely. So after you finish your PG in that particular specialty, that is a clinical experience you have, right? So you can apply for jobs like clinical fellow, senior clinical fellow, specialty doctor, specialty registrar if you have the Royal College exams also. And there you will find a lot of jobs where these are usually advertised at clinical research fellow, clinical fellow, or senior clinical fellow, where your Indian PG experience, during your PG you were doing training in that particular specialty, which you can showcase as your clinical experience in that particular specialty, and it can definitely help you.
Right. Is training important before giving the MRCS exams?
No, I won't say like it's important. It gives you a better understanding of the system. Like if you're working in your home country, if you're not exposed to the guidelines, NICE guidelines, SIGN guidelines, the UK system, and this exam is definitely the UK based exam. So that gives you an added advantage. I mean, this thing becomes easy. But I have seen a lot of doctors passing this exam while they are in their home country and working. So that is also an option. Like if you can give this exam back in your home country while working in that particular specialty, and then joining straight away some jobs in the surgical specialty, and further giving your training, applications and doing training that particular specialty, that really helps. A lot of MTI posts are available for Indian postgraduate doctors, Asian postgraduate doctors. They can apply for those MTI posts, especially in anesthesia. I have seen a lot, intensive care medicine, emergency medicine. So these posts are available where your experience can really help you.
Will clearing MRCS step 1 give an advantage to find a job more easily in the UK?
I would say, like, if you will see, a lot of junior level doctor jobs are more available, right? If you have cleared your MRCS and like you have some surgical experience, then definitely these posts will become little competitive, I would say. Like
little lesser as you
Yeah.
junior level, like you said, have more number.
Correct. So like it's easy.
More competitive.
Even if you give MRCS and start there as a clinical fellow, and then within 6 months you understand the scenario, the system, and then you proceed further as a senior doctor. Like straight away going and joining as a registrar could be sometimes overwhelming for you. So it's better that you go there, understand the system, maybe do a clinical attachment for a month or 2, and then apply for the training job or registrar job. That can help you.
Yeah, absolutely. Is the certificate ACLS BLS from India valid in the UK?
Usually they expect you to do it from Research Council.
Yes.
So that is like the most approved one.
Okay. What is the salary for the first year and the second year, FY1 and 2, and the working hours for the same?
Correct. So that really depends from like where you are getting this FY1, FY2, this thing. Like if you're working in London, it's more expensive,
Okay.
and they give you London waiting and some more allowances in comparison to different other parts of the England. And you get like roughly basic remains the same, like I think it should be £35,000 or above. And accordingly, like if you have some experience, and depends on the rota, how many night calls you are getting, weekend calls you are getting, out of social hours call you are getting, so you are paid extra for it.
Again, for MRCS, directly can it be given after internship? I think you have answered that before.
Definitely you can,
be given.
definitely any exam you can give, no problem with that, but definitely you need some experience to give this exam. You know, you should also understand the things, you know, being asked in that exam. So that's why just after MBBS, I have seen many students clearing while they are working in a surgical specialty in non-training job. However, if you are doing like your surgical training properly, and you are giving, many students give it in their first year of MS, whether they are doing some surgical like general surgery or ENT, etc. They give like in their first year itself MRCS part 1. So definitely you can give this exam, no problem with it.
How about the available jobs after Plab-1 before clearing Plab-2? Do you have any jobs there?
No jobs available. Some students who want to stay in the UK, they apply for clinical attachment. But I would say you cannot work as a medical doctor without a proper GMC license. That you can only obtain after clearing your Plab-2.
Right. Can we, okay, how to apply for GMC registration?
So once you, the different pathways are there as I discussed. The first pathway is Plab route, Plab-1, Plab-2. After passing English you give. Second pathway is the Royal College exam, that is MRCP, MRCS. Third pathway is MTI, Medical Training Initiative. There are some courses where there are some sponsorships also available, which you can check on the GMC websites.
Right. After FY2, can I directly enter my specialty?
Definitely. If you are there, if you have completed your FY2 there in the UK, you understand the system there, you understand, you know, the pros and cons of that particular specialty, and you are enjoying that specialty there, you know. So just maybe the way you are working back in your home country in say one department, say general medicine, may not be like similar there. So there could be different duty hours, different responsibilities. You have to attend different multidisciplinary meetings. You have to have some, you know, discharge planning and all that sort of things. So better if you are there, you choose the specialty you want to work whole of your life. You know, you should be self-motivated. That's what the you know, the choosing specialty statement is like. If you enjoy radiology, definitely you are going to enjoy radiology whole your life. So choose the specialty which you really like, you know, so that you keep yourself happy in that particular branch of medicine.
Right. So I think we've been talking about training and non-training jobs, but there are still a few students who want to know exactly what is a training and what is a non-training.
Correct. So non-training jobs means you are going and you are not part of a system where you are training in surgical or medical specialty. So non-training jobs are the jobs, for example, you are in general internal medicine or any surgical job you are doing as a SHO, as trust grade doctor, or as a clinical fellow, but you are not receiving a, you know, your competencies for the trainings are not getting signed. This post is not approved by the deanery as a training post. All right. When you apply for the training through ORIEL, you apply those applications where you are particularly doing the training in that subspecialty and leading further to giving your CCT, you know, the final exam, exit exam you give to become specialist, right? So the most of the jobs you will find, these are non-training jobs on the NHS UK jobs, health jobs website, whereas for ORIEL there is another portal through which you can apply for the training jobs. So that's why you will find most of the IMGs, they first go for non-training jobs and then they apply for the training job, so they understand the system better. You straight away going to training where they expect you that you should have all the competencies of FY1, FY2 doctor, and you should understand the NHS system, you know, for example, how patient is coming, where the, you know, patient's history and clinical details are, how to give those particular clinical orders, how to order medications for the patient, what are the red flags. So all those things you learn through Plab exams. That is what this exam is, to help you to reach to that stage and understand what a junior doctor in the UK is supposed to know.
Okay. Jobs like physician assistant, surgical assistant or compounders, are they available in UK without clearing the Plab or MRCP?
I don't think so,
No.
because physician associate and all, there are different
Assistant.
programs for it.
Okay.
There is no such clean assistant jobs, etc. I have seen.
Yeah, it's there in the US though, and after clearing MLE, but maybe that's why this overlapping.
Right.
No, I don't think it is available in the UK. What is CCT? You just mentioned
Core
CCT.
clinical training.
Core
So you
clinical
complete your CCT exam, core clinical training,
Okay.
to qualify as a specialist.
Right. Also, how to go about for IELTS and OET preparation?
Correct. So it's the English exam basic, the differences in, both the exams, they are checking your 4 skills: listening, reading, speaking and writing. In IELTS, the content is general, whether you are a doctor, you are going as a student, you are a nurse, physiotherapist, going for any other job, the content is same for the exam. They are checking your basic knowledge of English. Whereas OET is only for healthcare professionals. So here you are listening to a content where a professor is talking to a student or a doctor is talking to the nurse. So when you are answering the question, the content is medical content. In the similar way, when you are writing a referral letter to a specialist doctor. So the content, what you are reading is also a medical article, right? And what you are speaking, in the speaking test also, you are interacting on the medical terminology, because most of the healthcare professionals find it difficult after spending few years in the medical field, and then giving IELTS exam. Sometimes they don't find those right words, and it takes a lot of time for them to prepare and get the score, like you need 7 in each and overall 7.5 band. So whereas in OET it becomes easier because the content is a medical content.
Right. After the Plab part 2, these are 2 questions which are overlapping. Do we have to stay in UK to apply for the non-training or training course, or how long does it take to get a job after Plab?
So depends, like if you have a visit visa and you have the dates available, and like you have to intimate in advance, like if you want to do a clinical attachment. So many students after Plab-2 do a clinical attachment and then come back, because next time you will be going on tier 2 visa. That's what your health and care job visa. For that you have to be there in your home country. I really don't know about, like if you are in the UK and you can apply for that you can check on the home UK website. But mostly IMGs, they come back to their country and then they apply for the jobs, and after receiving the job they have to complete that whole process of occupational health checks, the visa checks, and then you receive the health and care visa, and then you move to the UK as a medical doctor
On a job visa.
Job visa, health and care visa.
Right. So again, we start back with the question, is GMC license mandatory for getting a clinical attachment?
100%. Definitely. You cannot practice medicine in
That's
England
how we
without a
started it, right?
GMC license.
True. So I think mostly a lot of overlapping questions are coming here. In case I have missed any of the questions, I would request anyone, all of you who are, listening, that please resend the question, since there was such a huge number of questions coming in. I may have missed a couple of them. So in case I have missed your question, kindly send it again, please. Any updates about UK MLE implementations for IMGs and FMG students?
Yeah, soon they are going to announce. So far, like they have said on the website, around 2024 they'll be launching this.
Okay.
But if you are successful in booking your Plab-1 exam now, like after passing English, that's what GMC has said, like they would arrange Plab-2 seats for all those who have booked the Plab-1 examination, so that you give the examination with this pattern only.
All right. How to apply for jobs after Plab part 2?
Right. So after passing Plab-2, you apply for GMC license first. Once you receive your license, even during this process, you can start applying for the jobs. Usually doctors prefer applying through NHS Jobs, which is a website, Track Jobs, which is an app, and Health Jobs UK. Some posts are available on British Medical Society page also, BMJ
Again, we'll
page.
share these links,
Yeah,
I think, for
on
students.
LinkedIn
We'll
also you
help
can
you.
apply, but
Yeah.
the preferred route is Track Jobs or NHS Jobs UK, where you can create your online CV, and with the same CV, like you can tailor for that particular post and you can apply.
Is after getting your GMC license, is there a compulsory number of years that you're tied up over there that you have to work?
Oh, this is not like compulsory. Many
Okay.
doctors, like, for if they have some family responsibility, they want to move out,
They
so
come
you
out.
can inform the GMC, like.
Okay.
Otherwise it's better, like, if you have obtained a license, so work for a year or two, and then if you want to take a, want to travel somewhere and take a break, etc., so you can inform GMC. All
And
those
you can
options are available, like you don't
can
want
take
to
a break.
practice in the UK,
Right.
you are taking the break, you will get your license back, so all
Yeah.
those options are available.
If we clear the MRCS, do we still have to clear the Plab?
No, if you have cleared your MRCS, all pathways, and receive all the steps and receive full license, then you don't need it.
Okay. Well, any suggestion for the source for BLS and ACLS certification?
I would recommend you better do it in the UK itself. When you
Okay.
receive your job offer, you go there, like you have few days always available before you start your job, and then you take this exam there itself in the UK, so that it's recognized.
Are there any offline training or diploma courses for post MBBS in the UK?
I have seen a lot of websites now coming up with a lot of these courses. I don't think so these courses are going to help you. I mean, other than, making your CV better, the best way is, like, obtaining a GMC license either by Royal College exams or by Plab pathways or by MTI. And then if you want to, like, show your keen interest in that particular specialty, for example, further you want to do specialty training in oncology, then you can do some courses there, but it's not like mandatory that you should have these courses, then only you can apply. Otherwise also you can apply, but they can show your keen interest in that particular specialty, and then you can speak to the panel who is interviewing you to showcase, like, you have spent so much of time learning on these online courses, etc. You have done some publications also in that particular specialty, so that can help you.
Couple of questions regarding the visa. Is first of all Plab valid in Qatar, and what is the passing marks for Plab, and any tips for speeding the visa process?
Correct. So when you are giving Plab-1, you can give this in your home country. When you are traveling to the UK for Plab-2, you apply for visit visa. There's a category where you specifically tell your reason that you are going for Plab-2. I'm not very sure it's valid in Qatar. I checked that this was valid in Dubai and Australia after Plab and after GMC license, General Medical Council license, and some years of experience. Somewhere they need 1 year experience, 2 years experience, depends, and then you can either apply for jobs there or training there. That you can check with the Qatar Medical Council board. And regarding the passing marks, there is an average they always declare, like for Plab-1 they always say, like, a student passed, the average was this much, so they take the average of the day and accordingly they declare, like, most of
So
the
it's like a
candidates.
percentile kind of a thing where
Correct,
the highest
correct. Day
scorer, lowest
percentage.
scorer, they make an average score.
Day average. Same in
Absolutely.
Plab-2 also, it's a day average. It's
Yeah.
not like a fixed this thing
Right.
that you have to score this much and then only you pass. Same in Plab-2 also, like, you do these many scenarios and
Yeah.
then pass.
Yeah.
So it's like a average of the day and then they declare you pass.
Right. Can we go to UK for clinical attachments and prepare for Plab-2 after clearing Plab-1?
Yeah, I have seen many of my colleagues doing that. They apply for clinical attachment, where you can write to different NHS consultants that you are a doctor, international medical doctor, you are giving these exams, you want to come for a clinical attachment, and you would request a letter for it, so that you go on a visit visa and you do this attachment there. And during that, I mean, if it really helps you in preparing for Plab-2, you can do that, but definitely it would be unpaid, you will not be paid, accommodation etc. will definitely require some cost. That's why we are bringing these kind of courses, to be honest, so that you really need not to worry to travel there all the way just for this preparation etc. Whereas all this can be done in home country with the same standard of like training you receive there, and then once you are confident enough, you straight away go to the UK and give your Plab-2 exam.
It's almost more than 3 months since the last Plab opening. How can I contact GMC to know the next Plab-1 date?
They will declare.
They will
always be updated with the website. They always declare. Whenever they are declaring, they always announce so that you can easily book.
Okay. What is the cost of FY1 and FY2 courses?
These are not courses, the foundation programs you apply. You are always paid during the foundation also. So after your GMC license, you can apply for foundation year 1 and 2 jobs. So these post what you are saying, and you are paid during this.
Yeah. When can we get our PR over there?
So the PR definitely depends from person to person. In general, what they say is like if you have worked in the UK for 5 years, there is a checklist which should be completed. And if you have lived in the UK for 10 years, then you can apply for ILR. But definitely it depends from person to person, it's your personal application. So a lot of things depends. It's not like in general, but this is the broad criteria I can tell you.
Right. So I think it's been almost 2 hours. We've been sorting out most of the queries. What I'm liking about this whole thing is there seems to be a good number of
very
students
curious, very
who are
nice.
very curious, who are interested, and we'll make sure that all the queries that we have left unanswered, we will try to answer within the next couple of days, giving you links, sharing you lots of details, including your visa queries. We'll go back, have a look at all the questions that we may not have answered. Dr. Shubhank may have probably told you that we'll get back to you about. Is the GMC valid in Singapore? So maybe the list of places that GMC is valid also, we could make a table
Find
for
out.
that and let you know. Okay. What I would like to probably, we have a few minutes where I would like to talk about what DAMS is doing for Plab, where I would like you to know mainly regarding your Plab Part 1 and Plab Part 2 courses. These are live. These will be live on the app on eMedicoz. We are going to have a live online, live and online kind of a hybrid thing, which is going to be there on the app for the Plab Part 2 course, which is a 3-day crash course that we are going to do. And the reason why we feel it is important for you to attend these classes are that it is very inexpensive. We are not charging too much of money. For Plab Part 1, it's 25,000 and 18,000 for the 3-day Plab Part 2 course. And it is very, very reasonable because they are going to make sure that they cover all the different scenarios for Plab Part 2 which you would need to clear. This would be like a huge benefit for those students who are giving their Plab Part 2 exams, because you need to make sure that you're not spending too much money. You don't have to travel anywhere. It is available in your home country, and once you come to know how to go about doing this, you can quickly just go off to the UK and give the Plab Part 2 exam without having to spend time staying there and taking these exams. So in future we would definitely try to make it a little more lengthy, but for the 10 days stay that we have with our educators here, they are trying to take the maximum time and giving you all time on our app as well as on the for the live program which we are going to have in Delhi. Okay, so Dr. Shubhank, you want to say something about our Plab courses that you are planning for the students?
Definitely, I would say like every doctor has this dream, of going abroad. I have seen, they really aspire to, start this journey of whether USMLE, UK, Australian Medical Council exam or whatnot. So definitely, I mean, it gives you a good training abroad. I'm not saying like options are not available in India or in your home country. Definitely you have all the options available, but I have seen most of the budding doctors, they have this dream of going abroad, learning best out there and then coming back to your home country or get settled there. We all are global citizen, and the best part is medicine is universal. So I'm so happy, so delighted that DAMS started this amazing course. I mean, because I remember my own struggle, like I traveled all the way to UK to give Plab-1, then again went there to do a clinical attachment, then again went there to do Plab-2 course, and then gave Plab-2. So it requires a huge amount of money, time consuming, that right guidance is sometimes not available. Even if you have friends and colleagues there, but they become so busy. So actually you need personal guidance for your applications. Your application may not match your colleague's application. Your aim, your aspirations would be different. You may be interested in doing some different specialty, not similar to what your friends are doing. So you really need individual support, proper feedback, help at every step. Like if your application is not good, all that goes into waste and you don't get like good job offers. For example, you are preparing for Plab-1 or Plab-2 and so much of time is wasted. Somebody is saying do this Q bank, somebody is saying this is the good book, this is the good video, this is the good course. So we just want your whole journey to be streamlined and hassle free, because I have personally experienced all those hurdles and difficulties. So I really want you to, when you start your NHS journey, it should be smooth. There shouldn't be any difficulty. You can definitely save a lot of money, which is spent usually while traveling there, knowing about all these things, and you get hands-on experience of Plab-2 here with the Siemens and mannequins. I think this is amazing. So far, like when I was giving this exam, this was not available in India. So once you have all those things available in a proper course, and that too taught by NHS doctors, and we ensure that you learn everything holistically.
I would say clinicians, they are not teachers. Many times I see students who have cleared Plab, they come along and they start teaching for Plab part 1 and 2. I think it is important that you learn from clinicians, people who have been working in the UK, because they give you the best insights. There are a lot of questions. Yes, I think we take the point that we need to do more webinars on different specialities, where we would probably try to get people from the speciality to talk about their journey to the UK, whether it is gynae obs or surgery or any other specialty. So that point is very valid, and we will try to do more seminars for that. Licensing in different parts of the world with the Plab, if you have a GMC, after your UK experience, will you need a DHA to work in Dubai, and what is the process for that? So there are these kind of questions regarding the licensing, which also would need a completely separate seminar, because today we were mainly talking about an individual's pathway to just travel to UK, their journey to make sure that they clear the Plab part 1, part 2, and then reach the UK, and what are the different aspects of their journey once they reach there, how to apply. Even for the application process for jobs as well as your CV, there are a lot of inputs that we will be providing you in near future, and we will make sure. What about a non-clinical field? Maybe we'll take a couple of more questions till we finish this. Non-clinical fields like patho and micro.
Yeah. There are good opportunities available in pathology and microbiologies, infectious diseases, histopathologies and oncologies. Okay. So all those are also available. Depends on your interest. If you are interested in this field, definitely there are jobs where you can apply. There are different fellowships which you can apply, medical training initiatives which you can apply. Definitely for everything you need a General Medical Council license to practice as a doctor. So that is like the mandatory thing. After obtaining that, you can definitely apply into these specialities, and I would appreciate like DAMS number would be there,
yes,
where you can WhatsApp your individual queries.
We will give you, I will again put the posters regarding our courses, because there is a student who's asking about our courses. Yes, 10-day live course. Apart from that, the same videos will be available for you for use for 6 months of use. So till you give your Plab exam, you can use the videos. The 10-day live course is simply because, just like you're chatting with us today, you have Shubhang sitting, whether he's sitting on across the TV or whether he's sitting in front of you, we are giving you the same inputs, right? So similarly, the Q bank would be also provided along with that. So the Q bank, a 10-day live course plus 6 months of videos that we have already provided in the live, will be given along with our Plab part 1 course. Okay. Yes, we will make a WhatsApp group on Facebook as well as on WhatsApp, Facebook as well as an Instagram group, so that we have all our experts in the group, so that all of you who are interested can come into that group, and we can constantly keep helping you out with your questions.
Correct.
Right?
And we'll try, even this should be available on eMedicoz app.
Absolutely.
So that later on you can review the whole video again, and also
this link to this video is available. We put it on YouTube as well, but always available on the app for those of you who have missed it. Of course, can see it, but those of you who came in late and have missed out a lot of information that students have been asking, because I think instead of making boring presentations sometimes, just saying what we feel is right, this is what helps the students most, where individually you are asking what you are confused confused about. So I think I should thank the students firstly for participating so wholeheartedly in this whole seminar, giving us so many insights to so many new questions that can come across, and I think we will also work on trying to clear every single doubt that you had here. How is MRSA different from Plab?
MSRA.
MSRA
MSRA
लिखा
exams
हुआ
you
है
give when you are there in the UK and you apply for the specialty trainings. There are few specialty training through these exams like radiology, psychiatry, OBGYN. For this you give this exam and then you apply for those specialty training. So these individual questions definitely write to us on the DAMS WhatsApp number.
Yes.
And we'll be very happy to answer.
We will create a group for sure, and we will be sharing it if possible on this platform itself. I will try and just now send you all the details so that you can quickly go over it. I think it's time to wrap up, not before thanking our guest, Dr. Shubhank, who is very much a part of DAMS now, trying to help us with the questions, with training. We're doing everything to make sure that we bring Plab to India, because like I'm seeing, there is huge interest, and we will make sure that it is worth it for you to go through our courses and try to get a job in the UK, which is probably your dream. And I have a lot of queries for MRCS, for MRCP, and individual courses for all the Royal exams as well, Royal College exams. So we will try to help you with every aspect of your UK journey, and very soon we are going to come up with all your answers, some new groups as we decided today. If you still have more questions, I will leave a WhatsApp number where you can send your questions. Plab at damsdelhi.com. We can you can send your email as well. Okay, so thank you again, Dr. Shubhank. You can also say a few words, and we wish you all the best. I would like
to say all the best to all of you for your UK journey, and I'm grateful to Dr. Sumesh Sethi, DAMS, Dr. Mala Srinivasan to make it possible to come up with such an exclusive course here in India to make the journey easy. All the best, all the doctors.
Wishing you all the best. Take care.